Well, today's Local on Tuesday Sponsor Spotlight focuses on our health. Listen to this. As many as 80% of people over the age of 55 will experience back pain.
For some, that pain may become chronic or lead to other health issues, but there is a holistic, non-surgical treatment that's available. Sylvia Castaneda talks with the Dr. Gil Center for Back, Neck, and Chronic Pain Relief in Franklin.
If you're 55 or older and you're experiencing back pain or having trouble with balance or even tingling in the feet, well, this next segment could change your life. With us is Dr. Wendy Toohey, who is with the Dr. Gil Center for Back, Neck, and Chronic Pain Relief. She specializes in non-surgical spinal decompression and spinal rehab. So good having you back.
Thank you for having me.
We were chatting just before we sat down, and you got teary on me because you were talking about how the last time you were here, people listened to your explanation about back pain, knew that they needed help, they came to see you, and what happened?
Well, I really want to thank you, first of all, because this platform has allowed us to reach new people. And what I'm finding is that wives are bringing in their husbands who've suffered for years, and finally they're getting some relief. So thank you so much. This has just been a blessing.
I am so happy to hear that. Well, talk to us about what are the root causes? What happens to cause that back pain, the imbalance, the tingling?
So as we age, the discs become dehydrated, less elasticity, and so they break down, they become compressed, and so they can even bulge. So this can be due to repetitive actions or sitting a lot, but what happens is when the disc breaks down is the hole the nerve comes out gets smaller, and now wherever that nerve goes, you can have pain, numbness, tingling, weakness, signs of neuropathy, but over time it can be quite debilitating.
So then talk to us about a solution, non-surgical spinal decompression. How can that help, especially with the disc? Kind of show us what that does.
Yeah, so it's different than what's traditionally done, which is medications, physical therapy, and those work the muscle, but spinal decompression is an alternative to that because it actually handles the cause of the problem, which is that there's pressure on the nerve, and it actually helps to reverse a disc problem. So it gently separates and pulls fluid and nutrients and rehydrates, so it creates space for the nerve, and when you create space for the nerve, pain goes away, symptoms go away, the numbness and the tingling of the neuropathy improve, and overall a person's quality of life also improves.
What about imbalance? Does it also help? Is there a connection there?
Absolutely. So that nerve that we're talking about, those nerves from the back go all the way to the tips of the toes, and there's fibers in those nerves that affect balance. And so when there's pressure on the nerve, it can affect stability, coordination. When you create space for that nerve, the person's balance starts to come back, along with them getting relief from the pain. So it affects so much more than just the pain itself. It can change a person's quality of life. And for a lot of our patients, they want to just be able to continue to live life on their own, have a shower on their own. Some of my patients are quite elderly and they want to be able to continue to live in their home on their own.
That totally makes sense. Well then, doctor, I know you have a special offer for viewers who are watching and would like to try this for themselves.
Absolutely. So for the first 10 callers, you'll receive an examination, consultation, and report of findings for only $49.
Doctor, thank you so much for coming back and visiting with us and sharing this life-changing information. Appreciate it.
Thank you again, Sylvia.
I'm going to send it back to you.
Thanks, Sylvia. Be one of the first 10 callers who qualify and receive your initial exam, x-rays, and reported findings for only $49. Call now, 615-551-3897.